Welcome to my life. Welcome to my life. Yes, it's okay. So, who is it? Who? If the Eve. Welcome to my life. Novara. JJJ Favik says hello. Hello, JJ. Hello. Welcome. JJ Favik, welcome. Welcome. Welcome to my life. Please double tap the screen. Double tap the screen. Any eye consultation, any problem about your eyes? Guys, sit tired? No, I'm not tired. I'm not tired. Thank you for the consent, Garcia. I'm not tired. Just ask me any questions about your eyes. Okay, look at my eyes. No, it's okay. It's okay. It's nature. It's okay. Lord Kevin say, hey, Black Mama, thank you. I'm here. I'm here. Black Mama is here. Welcome. Welcome. Welcome to my live. Lord Kevin, please double tap the screen. Double tap the screen to like, subscribe, and share. Lord Kevin, are you from Nigeria? I'm from Cameroon. I'm from Cameroon. I'm from Cameroon. Lord Kevin, I'm from Cameroon. Do you know Cameroon? Cameroon is a bilingual country. We speak French and English. So you can ask questions. Do you have a problem with your eyes? Any problem with your eyes? You just ask me. Even though I will not give you everything, I will tell you where to go to, the right hospital to go to. I will tell you if you go. JJJ say I have blood vision. Okay. Yeah. Yeah, you've heard of Cameroon, Lord Kevin. Okay, where are you watching from? Where are you watching from? You've heard of Cameroon, yes. Okay. From Los Angeles. America. Wow. How are you enjoying America? No, me, I'm in Africa. I hope you are enjoying America. Wow. Thank you. Thank you for supporting me. Please subscribe. Please subscribe to my channel. So what I was saying, JJJ say I have blood vision on my right eye. When you talk of blood vision on your right eye, how did you know that you have blood vision on your right eye, JJ? Because what I'm saying is that whenever you sit, you close your eye, and it's nice, but there's a lot of problems in the USA. There's a lot of problems everywhere. There are problems everywhere. The only thing is for you to stay out of problems. Stay away from problems. Mind your own business. Do the right thing. Because if you are doing the wrong thing, you enter problems. Oh, everywhere has problems. Even here in Cameroon, there are problems. There's even a lot of chaos everywhere. But stay away from the problems. Thank you, Lord Kevin. And double tap the screen. Double tap the screen, please. Double tap the screen to like and then subscribe. Lord Kevin, subscribe. Thank you for supporting me. So I was trying to answer JJJ, who said, I have blood vision on my right eye. JJ, if you did you close your left eye and you realize that there is blood vision? Okay, thank you very much, Lord Kevin. Thank you for supporting me. Thank you for supporting me. Ah, you liked and you subscribed. Thank you very much. So I was trying to answer JJ. When you say you have blood vision on one eye, it's something which is very dangerous. For it depends on the length of time. There's types of blood vision. Sometimes you have blood vision sudden. When it is sudden, just know that the problem is very big. When it is chronic, you could think of maybe that your eye has a refractive error. It's good to go to the doctor for the doctor to check. So when we talk of blood vision, we start with your cornea. There is a glass on the eye. When you open your eyes, you look in the mirror. There is a glass. There is a type of glass on the eye. That's a transparent layer which is on your eye. That is the cornea. So when you are having blood vision on one eye, it could be a corneal edema. It could be a problem. The blood vision could be caused by a problem on the cornea. If it's a problem that has been there for long, it could be a corneal scar. And there are so many people who are confused between corneal scars and cataract, especially here in Cameroon. See, here in Cameroon, most people, when they go to this traditional eye medicine, the traditional doctors, they say they can clear off the scars. And the next thing is they'll put traditional eye medicine. Before you want to see it, the eye is blind. The eye is blind. And another cause of that blood vision on one eye could be a problem in the anterior chamber. There are chambers. Your eye has chambers. There could be a problem in the anterior chamber. There could be blood in your anterior chamber. There could be pus in your anterior chamber. If you have blood vision on one eye, now, is it painful or not painful? If it's painful, rush to the hospital. If it's not painful, yes, still rush to the hospital, because there are problems that are painful and there are big problems that are not painful, especially now that you say you have problem with one eye. So rush to the hospital. If you are watching me and you have, why is everyone venting? I've not understood. J. McDonald, I've not understood your question. Why is everyone venting? Please, J. McDonald, where are you watching from? I've not understood what you said. Why is everyone venting? I've not understood. Please refrain your question. J. McDonald. Thank you, J. McDonald. Thank you. So what I was saying is that talked about blood vision on the right eye only. If you have a problem, just ask me. That blood vision could also be okay. Okay, this is Cyrilla. The name is Longo. Iceland yet. Hey, welcome, Siru Raktel. My God, your name is nice. Nice name, very long and nice. I cannot pronounce it. Welcome, and you are from Iceland. Wonderful. You're watching me from Iceland. Thank you very much. Thank you very much for supporting me. Please like, double tap the screen to like, and then subscribe. Kindly subscribe and share it to people who have eyes problem. Yes. What I was saying, Sigrid Lura Gatel, my God, my God. Nice name, eh? Yes, what I was saying is that if you have a problem with the eyes, kindly ask, you can ask me your problems, and I'll tell you what could be, and I'll tell you if you should rush to see an ophthalmologist. Who is an ophthalmologist? Somebody who is specialized in eyes. It doesn't mean that I don't prescribe eye drops here. I cannot prescribe any eye drop as I'm sitting like this. It's just to guard you. It's just especially here in Cameroon where we have so many people using traditional eye medicine. Some will come and say, I had a blood vision on my right eye and I started. Don't start anything. If you have blood vision, go to an eye doctor. Go to an eye doctor. Go and complain to an eye doctor. And again, I was saying that that blood vision could be caused by, if it is something that has been there for long, it could be a refractive error. If it's something that is sudden loss of vision, maybe it's just suddenly. There are so many things, especially at the back part of your eye. You have a back part of your eye called the retina. There could be bleedings on the retina. There could be bleedings on the retina. And what are the some of the causes of those bleedings on the retina? Are you diabetic or hypertensive? If you are diabetic or you are hypertensive, do routine checkup. Check your BP, check your blood pressure. What I was saying is that, sorry, thank you, welcome. Please double tap the screen, like, subscribe, and share, please. Thank you, Lord Kevin. Lord Kevin already supported me. I'm happy. I'm happy. Okay, what I was saying, JJ asked a question about. JJ asked a question about. Uh, uh, JJ said he has blood vision on the right eye. Then he has blood vision on the right eye. So what I was saying is that they could be, JJ. The question: are you hypertensive or diabetic? Are you so? Are you Let's continue. Let's continue our questions. So JJ talked of blood vision on the right eye. So JJ, as I was saying that there are so many causes of blood vision on one eye. There are so many people who could be having blood vision on one eye. And if you are having, oh, welcome to my life. Please like, subscribe, and share. Double tap the screen to like, please. If you have a question with your eyes, please let me know. Kindly tell me where you are watching from. I've seen people watching from Iceland. Somebody's watching from Los Angeles. Thank you, thank you, thank you. So ask me problems with your eyes. Any problem you have with your eyes. Like as I was telling you, there are so many people who have problems. They don't go for consultation. They just start putting traditional eye medicine, like in my country. They are fond of that. They just start. They just start putting eye drops in their eyes, and that is very wrong. It's very wrong. JJ said blood vision on the right eye only. And then I was asking JJ, are you hypertensive? Are you diabetic? Because the blood vision could be caused by maybe the blood vessels on the back part of your eye. Maybe there is a rupture in the blood vessels on the back part of your eye, and the back part of your eye is called the retina. It has very fragile blood vessels. So go and check yourself for hypertension, go and check yourself for diabetes. Yeah, welcome, welcome. Please double tap the screen to like. Kindly subscribe to support me. Kindly subscribe to support me. I'm here to ask about eye problems. Yeah, if you have any eye problems you don't understand, or maybe you prescribe some eye drops, I think I'm here to answer a few questions. And I'll always advise you when you have a problem with your eye drops or the eye drops, either the eye drops could be irritating. So you watch me, any problem, any eye problem, we're still talking with judges. So blood vision on one eye is something which is very serious. When you have blood vision on one eye, and how can you discover that you have blood vision on one eye? Put your hand on one eye and check the vision of the other eye. Check the vision of the other eye. If you realize that one eye is not seeing, I've told you the possible problems that you could have. Please, if you are watching me, please kindly tell me where you are watching from. Double tap the screen, likes, subscribe, and share. It will help me a lot. It will help me a lot. So another problem could be a detachment on the retina. Most people they have blood vision on one eye and they stay with the eye to until they are not seeing at all before they start rushing to the hospital. If you already see is mm, please double tap the screen. Subscribe. Yes, anything where I ask me, ask me. Please kindly like, subscribe, and share. Kindly like, subscribe, and share. Double tap the screen. Please tell me where you are watching from. Please kindly tell me where you are watching from. You have a problem with your eye, you don't understand anything. As Gigi has rightly complained of blurred vision on the right eye only. What I advise you is to go to the hospital and check the eye. Don't start putting funny things in it. Some people will start with traditional eye medicine. Others will start going to over-the-counter eye drops. Go to the hospital. You are advised to go to the hospital. I've told you the possible causes. It could be if it's a sudden problem. If it's a sudden problem, it could be a problem in the anterior part of your eye, like the cornea. As I explained, there is a glass. When you look at your eye, there's a glass that's protecting your eye. A transparent glass. That's the cornea. The cornea could be dim, and there are so many causes of that dimness. And if it is sudden, is it painful? Is it painful? Michelle Bafak say hello, doctor. Hello, Michelle Bafak. Hello, Michelle Bafak. Where are you watching from, Michelle? Michelle, where are you watching from? Please tell us where you are watching from. Double tap the screen to like. Please double tap the screen to like. And you have anything, any doubt? Maybe you have any eye symptoms which you are doubting? Kindly let me know, Michelle. As I was saying, I said, ah, from Cameroon. Where in Cameroon? Because I'm also in Cameroon. Please, where in Cameroon? Which part of Cameroon? Because I'm also in Cameroon. Let me know. Maybe you visit me. Maybe you visit my eye hospital. Michelle, where in Cameroon? Wow. I like to see in their area because I was talking here about okay, JJ say if my eyes are itching seriously, what could be the cause? Please. And now, JJ, when you talk of eyes itching seriously, for how long have those eyes been itching? That's what we should look at. And secondly, how old are you? I didn't say tell me your age, but if you are at, say between 1 to 12 years, is 12 years, and sometimes to 15 years, you could be having what we call vernal conjunctivitis. Vernal conjunctivitis. And that's the most cause, the most frequent cause is vernal conjunctivitis. And when we talk of vernal conjunctivitis, you could be allergic to something which we don't know. You could be allergic to something which you don't know. Cameron Consamba. Ah, Michelle Backpack is Cameron Consamba. Okay. I'm in Betwa. I'm in Betwa. Do you know Betwa? Uh-huh. I'm in Betwa. Yeah, I was talking because so many people come to the clinic after experiencing a lot of symptoms. They start using over-the-counter eye drops. They start destroying their eyes. It's not good to destroy your eyes. Better go and see an eye doctor. And if you have any worries about symptoms, any symptoms, you let me know. And JJ says, my eyes are itching seriously. JJ, your eyes are itching seriously. There's one thing I must tell you, as I was asking you about, I don't mean you should tell me if you are below, say 5 years, if it's the eyes of a child itching, below 5 years, don't scrub. There's what we call keratoconus. Some children have allergic conjunctivitis, vernal conjunctivitis, and they start rubbing on the eye. They are rubbing on the eye seriously. It's very, very bad. Thank you. Welcome. Please double tap the screen. Double tap the screen. Subscribe. It will help me a lot. And share. And if you have any problem with your eyes, ask me. If you have any problem with your eyes, ask me. Kindly double tap the screen, subscribe, and share. Thank you very much. Papa Michisi. Okay, Papa Michisi from Kongsamba. Yes, I know even around Kongsamba in Cameroon, you see, I'm watching from Kongsamba, there are a lot of patients who go to the hospital with problems, and the next thing you want to see is using over-the-counter eye drops. They just buy eye drops from anywhere, which is too bad. And the JJ was talking about eyes itching. And I was saying that when your eyes are itching, don't rub your eyes. Don't rub your eyes. It's good to go because you said the eyes are itching seriously. And no, the go and see the eye doctor. Go and consult. If it's a small child, prevent that child from rubbing the eye and go to the eye doctor immediately. Because if it's a child from 0 to below 12 years, when a child starts rubbing the eye, that child can easily develop what we call keratoconus. Oh, Animal Marvel. Animal Marvel, thank you. Thank you for the likes. Animal Marvel, where are you watching from? Kindly tell me where you're watching from. Animal Marvel, kindly tell me where you're watching from. Please, Animal Marvel, like, subscribe, and share. Double tap the screen to like. Animal Marvel, double tap the screen to like. Thank you for the love. Thank you for showing me love. So what I was saying is that when a child below, from a child from between 1 or below 1, okay, watching from Hong Kong. Hey, Animal Marvel is watching from Hong Kong. Welcome, Animal Marvel. Thank you for supporting me. Thank you for supporting me. Oh, I'm really grateful. So as you can see, I was trying to tell you, JJ about JJ asked me about itching eyes. So I was trying to say that don't rub the eyes. If it is a small child, that child should not rub the eye. You know when you take a balloon, I hope we all know a balloon. When you press on that balloon, very soon you have a loose part. That's how keratoconus comes about. You know the cornea as you are growing, uh, your cornea is really still weak, still soft. So when you start pressing on it, you can just have a loose part like a balloon. and that is keratoconus. Okay. So somebody is asking a question here. The same JJJ say, can a baby of 2 years diagnosed of cataract? Yes. Wow, wow. If you have your 2 years old that it is already late. If you have a child already 2 years means that child is already late. Abdul Jet, I'm short-sighted. I'm using glasses for more than 10 years. Is there any chance of being normal? No, there are no chances. You have to continue using glasses for life. Continue using your glasses. Unless you go for refractive surgery, there are some surgeries that they do. If you are here in Africa, you continue with your glasses. Keep your glasses. When you see when you go and see your optician, I know they were given to you by your optician. Animal mother say wonderful. Yes, those glasses were given to you by an optician. And whenever the glasses are a bit weak or you have a problem with the glasses, go back and see your optician. But you must continue using your glasses. Continue using your glasses. They are not. Okay. All right. Marvel say wonderful. Thank you, Animal Marvel. So Abdul Jed, go to go and see your optician. And your optician has to explain to you very much. Always put on your glasses, always. There is nothing as unless you want to go and sleep. Unless you want to go and sleep, that's when you say, okay, let me remove my glasses and protect them. Always. Or maybe you want to go and bath. Or maybe you want to go and bath. If you are not bathing, you are not sleeping, always put on your glasses. You were born like that. Short-sighted means you are myopic. Eh? Myopia. But if you are myopic, the only thing it can be of advantage when you are getting old, you can read without glasses. That's the advantage myopic people have. Be happy with your problem. It's good. It's nice. So when you are getting old, you can read without glasses. Can keep your glasses and read. That's that's the advantage of that one. And when you are a myopic patient, go to the hospital. Always have some routine checks because there's something we call retinal detachment. It's common among myopic patients. Try to go to the hospital for routine checks. And even there are things like glaucoma. Glaucoma is common. So when you are having problems, you are myopic, try to go to the hospital once in a while, check your eyes, take care of your glasses, wear your glasses, always put on your glasses. That's good. Animal Marvel say my doctor is recommending contacts. I don't feel comfortable wearing them. Animal Marvel, let me tell you, there are a lot of disadvantages with contacts. You are in Hong Kong. You see, you're in Hong Kong. Well, if you're in Africa, especially here in Cameroon, don't put it on. Because first of all, one, here in Cameroon, we it's contraindicated. It is completely contraindicated because if you don't know how to take care of those contact lenses, it's a big problem. You can develop corneal ulcers. But then in Hong Kong, again, I will advise you not to use it because if you start going rubbing your cornea trying to fit the lenses, sometimes they need to take them out, fit the lenses, take them out. I'll advise you as my own advice. That's my own point of view. I will say, don't take it from me. Don't take it. Don't take those lenses. Especially when some people go swimming with contact lenses And there is a type of cornea disease, acanthamoeba. When it attacks your cornea, hey, you are okay. Animal Marvel said, "Thank you, doctor." Well, Animal Marvel, I've given my own point of view from Africa, from Cameroon. We are, that is contraindicated here. No, I don't even advise. I don't advise things like that. People don't even have these the chemicals, the products to keep the contact lenses clean. And the next thing is they come with corneal ulcers. There is Animal Marvel. Let me tell you a question. Let me tell you, there's one lady, these contact lenses, these cosmetic contact lenses. One small girl, that lady was about 19 years old. That lady was 19 years old now. She came here after using it. She developed a corneal ulcer and went to over the counter drops and went and bought eye drops, and the cornea started melting. There is a glass on your eye, it melts. And that girl is completely blind on one eye till today. Till today. So contact lenses, I will say no. Don't do it things like that. Just go for your glasses. If you have refractive error, go and take your glasses, put on your glasses, and it's easy going. Than to go and take contact lenses. Or sometimes some people say they go for refractive surgery and the rest. Here in Africa, that thing has not reached here. The only advice I will give is no, no, no. It's a no, no. Don't go there. Don't go for contact lenses. Thank you, Animal Marvel. Um, please double tap the screen to like. If you can help me to subscribe, you subscribe. Animal Marvel said, "Thank you so much for sharing. That's great information." Yes, thank you to Animal Marvel. Thank you, Animal Marvel, for trusting me. What I will also say is that, um, like here, in my region, Black Man country, Africa, not everywhere in Africa, where in my region, when I say in my region, there are so many people what we call corneal ulcers, and most of them, before they come to the hospital, they are already blind because one, lack of knowledge. Lack of knowledge is not a good thing. Lack of knowledge is not a good thing because sometimes like now you have asked me if you should use the contact lenses, and I've given you my own point of view. It's good to go and see your eye doctor again, consult your eye doctor again. Some people stay in the bush. The next thing is they start putting traditional eye medicine. That's the next thing. And when they put traditional eye medicine like that, it's a different problem. In the long run, they become blind. So when you have a problem with your eye, rush. There are so many people in my area, they don't have all these facilities. They need to travel far to go to the hospital. So if we give them this information, one patient also came here with that patient is just a small foreign body. It's just a small foreign body that entered the eye. And this patient went to buy over the counter eye drops and started using them. And when the thing became serious, the patient came here and now the eye is blind. You could solve an eye problem just with a question. Just asking a question. And if I don't understand your question, or if I don't know the answer, go to another eye doctor. I mean, nobody really knows all. Go to another eye doctor to explain to you. But when you come here, you ask a question. I'm really happy I'm here to answer your question. And then JJ said, "Thank you very much, doctor." JJ, thank you to JJ. Have you subscribed? Like, subscribe, and share. JJ, like, subscribe, and share. Double tap the screen to like, JJ. Thank you very much. Yes, it helps me a lot. When they subscribe, it helps me a lot. Thank you very much. Yes. If welcome to my life, please like, subscribe, and share. To like, you double tap the screen. It will help me a lot. Okay, there is a question here. This is who Michelle Baba, my child's eye is discharging. What can be the problem? And what can I do? Now, the first thing is when you talk of your child's eye discharging, uh, Michelle, we talk of it, the eyes discharging, are both eyes discharging? That's what we should first of all say. For how long have the eyes been discharging? Have you gone to an eye doctor with the discharging eyes? Because when you look at the eyes, there are different types of discharges. There are some charges that are like pursy discharges. There are some discharges that are like purse. You can have some discharges that are like ropes. Some people, like in my area, that some people call it worms. Some people say they are picking worms from the eye. So when your child's eyes are discharging, if you have not gone to an eye doctor, start going. Go to an eye doctor because it could be what we call conjunctivitis. It could be bacterial conjunctivitis. If you are talking of, don't start buying eye drops. I'm just talking because before many people, before they want to come to the hospital, they've started putting funny eye drops, and when they come, we cannot do anything again. So when your child's eyes are discharging, for how long have those eyes been discharging? Have you gone to an eye doctor? Or you are only at home? Have you used anything? Be honest. If you have used anything, be honest to tell me you have used something, and I will know what to tell you. But again, I'll repeat, I don't prescribe here. I don't prescribe here. I'm only here to explain a few things to you and to advise you to go to the hospital. And when your eyes are discharging, I want you, it is what we call eye hygiene. You take toilet tissue. When the child's eyes are discharging, you take tissue. You ask the child to close the eyes. You clean from in out. You throw it. Take and clean the other side from in out. You throw it. And there is something. Those discharges. Most people come here to the hospital. They say they've put breast milk. Don't start putting dirty things like that. Don't start that type of dirty behavior. Breast milk is for children, and you think of putting it in your eyes. And some people even come with they say they put salty water. Hey, what is the concentration of that salt? And some people even come, they say they've gone to Babalao, native doctor. Uh, if you're in wine man country where maybe they are not native doctors, if you are here, native doctors are many. As you say, oh, those discharges, they can start giving you medicine. No. So what I'm saying is that it depends on the type of discharges. You could have what we call bacterial conjunctivitis. Means there could be bacterial infection in the eye. And then there could be there's a type of conjunctivitis they call viral conjunctivitis. With that one, you have watery, just water coming out. That's what we call Apollo. Even though the local man does not call that one Apollo, they call by the one with the pus. So the discharges, uh, Michelle Bafak, the discharges, are they pus? Do they look like pus? Sometimes when if that those the child's eyes are discharging, some say they get up in the morning, the child cannot open the eye. The child cannot open the eye. With that type of a problem, if you just soak your face towel, if you don't have a face towel, you soak the edge of your towel, your bathing towel, and then you damp the eyes a bit. You damp the eyes a bit, and then so when I talk of bathing towel, I don't mean the one that you use to clean your private part. I mean like there could be a big towel in the house, very clean, a nice towel, very clean. Don't go and use a towel that you have used to clean maybe other things or clean or the other part you use it. That's the worst thing to do. Because maybe some people could be confused. Or you have a clean handkerchief. Or let me just say, let's leave that towel thing out. Maybe you have a clean handkerchief, you soak it in maybe warm water, in tepid water, warm water, very warm water, not in hot water. I didn't say go and burn that eye. Warm water, and then you damp it with it for some time. After some time, it will open. After some time, it will open. We have those problems here. I don't know if there's somebody who is watching from USA. You say you're watching from USA. I doubt whether you have those problems in USA. But here in Africa is very common. Very, very common. Not here in Africa, here in my place. Let me not say in the whole of Africa, no. In my place, in my own place where I'm located, is very common. You see, they get up in the morning, a child is unable to open the eye. You just ask the child to close the eyes and you put water on the eyes. The child to close the eye, you put water on the eye, you clean it. Mm. I hope I've answered your question a bit, Michelle Backfap. I hope I've answered your question. So thank you. Thank you for joining my live. As I've said, maybe some people could use the towels to clean other parts. Don't use that towel. We're talking of a clean towel, very nice towel. You can use if you don't have a face towel, or you use a handkerchief, or you take a nice piece of cloth, very neat piece of cloth. You damp it and use it. Me, I'm in a poor country. Here we are poor. We don't even have face towel. Most people don't have. Most people don't have face towel. So because this thing I'm doing is very important. I've had a lot of patients using traditional eye medicine. I mean, the number of eyes that are getting blind here are really devastating, especially with these people who go and start using native medicine. Remember, in my area, anything you want to buy from the pharmacy, they will give you. Unlike in some countries where you want to go and buy food, they say bring doctor's prescription. We don't have all those things here. You can just pass anywhere and buy eye drop and you go. That's why I'm trying to explain certain things. If you're in a country where they say bring doctor's prescription before they give you eye drops, fine. But if you're in a country like my country here, you pass and buy anything. Anything. It's your money and it's your eye. So that's why I'm trying to at least let people have an idea of certain problems. So as Animal Marvel asks about contacts now, here is a no no no. Is a no no no. Welcome. Please double tap the screen. Kindly double tap the screen. If you have a question, you ask me. Please double tap the screen, like, subscribe and share to support me. Wonderful, wonderful, wonderful. Please kindly tell me where you are watching from, and what are the problems? What problems have you also experienced? It's an experience, or do you have even a neighbor with a problem? Just ask me. I will explain things to you because there are neighbors. There are so many people who come to the hospital. They say is their neighbor who advised them to to put in traditional eye medicine. In Cameroon, I know so many eye hospitals. I know so many. I know where to, if you are located around Cameroon, I know where to direct you. I know good eye hospitals to direct you. You must not only come to my hospital, not only to my hospital. I know eye hospitals so many, but if you want to come to my hospital, I'll give you, I'll know, I'll tell you what to do. If you can go to other eye hospitals nearer to you, if you tell me where you are located. If you tell me your location, I'll tell you where to go to. You must not leave and go to a particular eye hospital because you know somebody there. Yes. If you tell me you are, but if you're in white man country, hey, then in white man country, you have so many hospitals. The facilities there are huge. You have your huge facilities there. When I talk of white man country, I mean Europe, America, and the rest. So come here, I'm in black man country. Somebody even greeted me that hello black woman. Oh, I'm happy. Thank you. So welcome to my life. Kindly like, subscribe, and share. Double tap the screen, subscribe. It will help me a lot. Okay. As we're interacting, as I was saying, if you have a problem with your eyes, ask me. If you have a question, either concerning your neighbor or yourself or your brother or your sister, just ask me. I'll answer and tell you what to do next. Mhm. JJ said, thank you very much, doctor. Thank you. Any more questions? Any more questions? You have anything that is disturbing you, or anything that is disturbing maybe your grandmother? There's a patient who asked me, my grandmother was blind. My grandmother got blind, and when I went to the village, one Hausa man visited her. And when I looked in her, I saw a white thing in her eye. When I went to the village, I did not see the thing again. Hey, couch it. They've gone and pushed the lens. Then the Hausa man went and did something in the eyes. They've gone and pushed the lens. So only B was seeing a bit. But all those things, try to inform. Welcome, welcome. Please double tap the screen to like, subscribe, share, subscribe. Will help me a lot. So if you have a question, ask me. If you have a question about your eyes, I'm here to tell you what to do next. I'm here to tell you what to do next. Michelle Baba said, thank you, doctor. Thank you, Michelle Baba. I hope you have. Gigi, it is normal for a patient that complains of foreign body sensation. Is it normal? Is it normal for a patient that complains of foreign body sensation to get eye drops from any nearby pharmacy? I've just said no, no. Don't go to any pharmacy to get eye drops. If you have a foreign body sensation, go to the nearby hospital, nearby clinic. It depends on the type of foreign body. Are you because now it's farming season? Now it's farming season. So I will mostly be talking about foreign bodies from their farm this week. I'll be talking mostly about foreign bodies. Now it's farming season. When you go to the farm and something falls in your eye, if you have water in a container, you try to wash the eye and you rush to the hospital. Don't stay there and start using, don't cut grass to remove a foreign body from your eye. That's the worst thing to do. And don't start buying eye drops from quacks. These over-the-counter eye drops. You might buy the wrong eye drop, and the problem will be the eye drop and not even the foreign body again. Let's be very careful. The problem could be the eye drop and not the foreign body again. So, JJ, when you have foreign body sensation, don't go to a nearby pharmacy. Go to a nearby eye doctor and explain your situation to the doctor. Thank you very much. Thank you for joining my live. Please like, subscribe, share. See you next time. Bye.
Ta-da!